Hello, welcome back to the channel. It's me, Emmy the Cat Lady, and you join me here in the Commonwealth with this poor soul that died on the front steps of a hospital that now has been taken over by the super mutants. So we're back with Emmy's Wasteland Survival Guide, and we're continuing with the discussion about medicine and treatment and keeping yourself alive and healthy, which is obviously very important to surviving. So last week we discussed sort of medical training and the ins and outs of becoming a wasteland doctor and the kind of scarcity of diagnostic equipment and training and things like that. But once you have an idea of what's wrong, you're going to need to get treatment in some fashion. And obviously we're talking about a fictional world in a video game here, so there's a wee bit of suspension of disbelief needed, as the mechanics of treating illnesses and injuries can't be anywhere near as complex as it is in real life. Otherwise the game would end up several terabytes in size. So when we're talking about medical treatment, there's kind of two fairly broad categories. So surgical procedures, so any kind of procedure that involves putting something into a part of the body or removing something from part of the body, and medical, so treatment with medications, with fluids, all that kind of stuff. So we're here at the Medford Memorial Hospital, which is here, so it's kind of fairly central in the map. So yeah, Covenant's there. Where are we? Yeah, Oberland Station's over there. So we're kind of just directly east of the Starlight Drive-In. So in this kind of middle of the top of the map kind of area here. So we're going to head inside. So surgery is a lot easier to talk about than it is to actually do. So in essence, surgery involves you removing something, repairing something, or trying to find some kind of cause or diagnosis in order to plan treatment. And sometimes you do just have to go in and have a look to get some answers. There's some grenades there. So yeah, you can see that the mutants have made themselves right at home in this hospital. So I'll head upstairs to say the main reason I wanted to come in here is because this hospital does actually have an operating theatre that you can get into. I thought that would be an appropriate place to have this chat. Here we go, operating theatre with Mutant Hound and a super mutant. So let's just get rid of them so that they shut up. There we go. Yep, so operating theatre. Ideally you would have access to plenty of sort of pain relief, anaesthesia. You know, that was one of the biggest inventions of medical history and made a huge difference in terms of good outcomes for patients. So that's obviously very important. But surgical procedures, you can be doing anything from removing a foreign object. Obviously I mean something like a bullet by that. You could be removing an entire organ, you could be amputating a limb, you could be putting things back together, you could be stitching a little cut, reattaching a finger, or even putting somebody's insides back on the inside. So the procedures vary depending on the situation that you are faced with. Obviously this guy would need an awful lot to be fixed, given that he has nothing left but his bones. But there's some very important basic surgical principles that are taught to anybody that's studying any form of medicine or surgery. So aseptic technique is the most important one, and that means that everything is clean, everything is sterilised, and we're controlling bacteria and infectious agents and keeping everything as spotless as we possibly can. That means no unauthorised members of staff in the operating theatre, thank you. I'm not sure what the handcuffs are for. So you can see up here we've got sinks and things with mirrors, because if you're going to be performing surgery you're going to have to scrub your hands at some point. Anything that's going to be in direct contact with the patient should be sterile and clean as possible. So gloves, instruments, the skin of the patient, the skin of the surgeon, clothing and everything. And there's very specific protocols and methods for making sure that things are as clean as they possibly can be. So what I mean by that, there's a specific method of scrubbing your hands where you go around each finger and you start at the fingertips and you work your way down to the wrist, and you're basically, when you're rinsing your hands, you keep your fingers upright and your elbows down so that the water runs away from the clean area towards the not clean area, all these things. So it's very specific technique. There's also specific techniques for how to put on the gloves, so you want to avoid touching the outside part of the glove with your bare hands. So you have to put the gloves on by only touching the inside of the gloves and the inside of the cuff. So there's specific techniques that surgeons have to be taught in order to do that. And you need to know what you can and can't touch. So once you're scrubbed and gloved and gowned, you're sterile. So you need to be aware of what's sterile, what you're allowed to touch, and what's not sterile, which you're not allowed to touch, because then you're contaminated and you'd have to go and scrub and start again from the beginning. And nobody's really got time for that. So it's all done very specifically. Unfortunately, when it comes to media, these kinds of things aren't always included, and one that really bugs me and it really annoys me, because I actually watched the film again quite recently, is in Doctor Strange. So the first Doctor Strange movie, he is, at the beginning, he's about to perform brain surgery, so he scrubs his hands and he puts his gown on and he puts his gloves on and then he puts on his mask, and that is just flat out wrong, incorrect, because those masks, they're clean but they're not sterile. So they should be put on first, and when it's not sterile, if you've scrubbed and gloved, you should not be touching that. So either an assistant would put it on for you, or you would do it before you start scrubbing and gloving and things. And it's one of these things, it's such a minor nitpick, but it just makes me cringe every time, especially because he's a bloody neurosurgeon, he's about to go poking around inside somebody's brain. We should be maintaining sterility. That's just, it's such a minor thing, but it's just so incorrect. It's really, it's a bit of a pet peeve. But, if you watch Grey's Anatomy, they generally seem to have it down for the actors for how to actually prepare for performing surgery properly. But of course, when you're in Fallout or you're in another post-apocalyptic setting, or you're in a war zone and things like that, then you might have to settle for clean enough. You're not going to get perfect sterility. I hate to think what it would take to actually clean this place and sterilise it, given the gore bags everywhere and the absolute mess that's been left. So you might have to make do with just trying to keep things in as clean as possible and killing bacteria as much as you can. So it can be challenging. The other major thing is tissue handling. So you want to be gentle with handling the tissue, especially the bits that are just going to stay inside the patient's body when you're done. If you do too much damage, then it's not going to heal and it's going to end up looking like this. It's not going to heal properly. So using the right instruments to handle the right tissues is an important thing, and also the sharpness of blades. So surgeons will use obviously scalpels, everybody knows that, and you use surgical scissors in some cases to cut tissue. They have to be sharp. If they're not sharp, then they're going to do more damage to the tissue, especially if you're incising the skin. If it's blunt, it's going to tear, it's going to do a lot more damage to the skin, and that just means it's not going to heal very well. And it's also important to know your anatomy, so know which bits are supposed to be where, know where the blood vessels are going to be, know where the nerves are going to be. You need to know all that if you're going to perform surgery, to make sure that you don't accidentally remove things that you're not supposed to remove or damage things you're not supposed to touch. And the other big thing is hemostasis, is the word that's used, which is controlling bleeding. So blood loss is a major complication of both surgery and trauma, so any major injuries leading to blood loss can be very serious, and if you accidentally cut a major blood vessel, then the patient losing too much blood can also be a problem. So at least conveniently, this one, we've got some blood packs handy. So you want to know your patient's blood type as well, ideally, but you do want to make sure that you're controlling bleeding to the sake of the patient, but also for the sake of the surgeon, because if you're operating on somebody and they're bleeding and the blood just gets in the way. It blocks your view, so you've no idea what's where, no idea what's going on. You need to get that under control, because it's just going to block your view. So you'll see that you'll see it on TV shows and movies all the time. You've got swabs and sponges to soak up the blood. You can put clamps on to kind of stop the bleeding from vessels. You can tie them off or ligate them using suture material, especially if that's something that's going to be cut, that blood vessel, or it's something that's going to be removed. You need to tie off the ends of the blood vessels to control the bleeding. For more serious kind of situations, using a tourniquet, such as on a leg or an arm, is a temporary reduction to the blood supply, which can make your operating site cleaner. But you can only keep tourniquets on for a short amount of time before the tissue's been deprived of oxygen too much, and then when you take it off, you get a reperfusion injury where all the blood flows back into the limb and causes a lot of damage because there's too much blood pressure and things like that. So important to be aware with tourniquets. You can't really keep them on for more than sort of 15-20 minutes is kind of the maximum time frame for that before you'd have to take it off for a little while. So it's an option as well, and being prepared to use a tourniquet in the field could save somebody's life. And cautery as well. It's not really any good example of that kind of thing here, but I would assume that they have the technology for that. So cautery is a way of basically burning the blood vessels to stop them bleeding. Very effective on little tiny blood vessels if there's lots of them, rather than trying to tie them all off individually. But it's less effective when you're dealing with the kind of larger veins and arteries, especially arteries that have higher blood pressure. A cautery works either it's direct heat, and that's how they used to do limb amputations before anaesthesia was an option, where they could take their time to do it properly, and they would use some heated metal to basically burn the end and stop it from bleeding. Pretty unpleasant, to be fair. But nowadays we do have electrocautery available, which uses electricity and electrical currents to generate the heat and burn the vessels and things, and that can be very, very useful, especially for microsurgery, that kind of thing. So that's something that's quite readily available, and I would assume it probably is available in some fashion in the pre-war Fallout world. There's lots of limbs there, so at least in here we've got plenty of spare organs and bits if we need to, if we want to pull a Frankenstein or something, I guess. And then closing the tissues, so you want nice healthy edges, especially for like the skin and the muscle layers. You want everything to be nice and fresh and healthy, and you want to kind of close over so that the edges are aligned properly, because that will heal better. But don't pull it too tight, because if you try and force the edges together too tight, then you cause damage to the tissue and it becomes infected and it becomes inflamed and it all falls apart. So not too tight when you're stitching skin. You can use sutures or stitches, you can use skin staples, and for smaller wounds tissue glue works quite well as well, depending on the situation that you're dealing with. If the skin's very thin, if it's a small wound, that kind of thing. You don't want to have any empty space between layers, like between the skin and the muscle, because the body will just fill in that space. The body doesn't like empty spaces. It'll fill it in with fluid, and then everything will just kind of break down and you'll risk infection. So these are kind of the most important things when you're dealing with a traumatic wound. So yeah, like for example, obviously this guy's lost it. Well, he's lost all his bits, but he's lost his arm and his leg. So if you're dealing with a big traumatic injury, you can kind of see actually the art style does lend itself well to this. That that's not a nice smooth edge to the wound. It's quite rough. So if you were to try and stitch that closed, obviously assuming that he wasn't actually dead, if you were trying to close that as is, it probably wouldn't heal very well because it's got jagged, rough edges. So for a wound like that, you would want to kind of clean and debride the edges of the skin and make it nice and smooth, so that when you do close it, it's going to heal better, and it's going to, you're not going to get a really nasty scar, and it's going to look much better. It's going to be much better for your patient. So those are all your major kind of surgical principles for if you were to carry out any kind of surgical procedure. And your setup, obviously, you want the place to be as clean as possible. Good lighting helps a lot. You need to see what you're doing. It's no fun operating by torchlight, which has happened when power cuts happen and things like that, but having good lighting makes a big difference, and making sure that your instruments and everything are all well maintained and nice and clean. So obviously in the Wasteland everything has kind of broken down, everything's destroyed, so you're not going to have ready access to everything that you would need, like autoclaves, which use kind of high temperatures and steam to sterilise your instruments. I think this might be like a viewing gallery. A lot of operating theatres will have kind of viewing galleries for med students and the like, and people to observe procedures. That's an extremely common thing. So it'd be the kind of thing that you'd expect to see. But yeah, there's not really anything that looks like it might be an autoclave in here. I don't think there's really an asset for that in the game, but you would have something. But having these in the Wasteland's probably not the easiest thing. So you need to maintain your instruments, you need to maintain them very, very carefully. So your blades need to stay sharp for better outcomes. Needles as well, for suturing needles, and also injection needles, fresh injection needles. I mean, ideally you would use single-use disposable ones like we do in the real world, because even after one single use they tend to blunt, and then it's more painful, more difficult for administering the injection. It's just not a good time for everybody that's involved, really. So it's just making sure that you can. And obviously one thing that people would do, you're not, one thing that you're going to do is, just deal with that. Yes, I did. Shut up. So a lot of people would come to places like this, obviously a hospital. If you're looking for medical supplies of any kind, then obviously going to the hospital is going to be your place to start. And this one actually still does have a fair amount of stuff kicking around. You've got some fairly clean looking gurneys and things, microscopes, all the kind of thing that you need, although again, doing diagnostics like that, it's not going to be an easy thing to do. So when it comes to maintaining sterility and things like that, then you're going to want to try and find methods that work for what you've got available to you. Just actually fell off the balcony there, that was clever. So you might have to go kind of old school, which means using things like alcohol, which there does seem to be plenty of around the place. In a pinch you can use vodka, whiskey, whatever, you can do that. Probably not the best thing, but when you're in an irradiated wasteland, you might do with what you can get your hands on. At the end of the day, that's the way things work. Baraxol probably works quite well for cleaning surfaces and things. Wouldn't recommend using it on the body, on the patient's skin or anything. In fact, yep, there we go, we've got some whiskey, stim pack and blood pack, and then there's some other things there. So it's obviously where they keep the medical supplies, and I'm pretty sure there is a Massachusetts Surgical Journal in here, but this place is obviously being cleared out by me and then respawned after a while, as it is wont to do. Oh, got another guy on a gurney. But keeping your space as clean as possible. I mean, obviously most of these hospitals now and things, it's going to be quite a challenge to do that, but trying to keep it as clean as possible if you're going to be performing surgery, cleaning the skin, cleaning everything around any wounds and things. That's obviously all very important. Know your anatomy, so your leg bone's connected to your hip bone. Know where everything is. You need to know what you're doing. Really, closing a wound, a skin wound with sutures, that's kind of easy enough, I think, for most people to be able to sort of intuitively figure out roughly what they should be doing when it comes to that. But if you're going to go and start removing spleens or digging around in major organs, you really do need to know what you're looking for. And the other thing is, oh god, this place is just absolutely hoaching with super mutants. Go away.
Hello, someone there?
No, shut up. Yeah. Okay, so yeah, we've got a ward here. Place is just completely trashed. Yeah, and then you've got these obviously medical gas. So oxygen and things, having oxygen is a good thing to be using when people are under anaesthesia and having surgery and anaesthetic drugs and things. Again, you're just going to have to kind of raid hospitals and hope that there's still stuff left behind that you can use if you're going to do something kind of crazy. But you'd make do with what you can, and having antibiotics available would be a good idea for two reasons. One is that proper aseptic technique is going to be extremely difficult in the Wasteland because everything's trashed, and the other reason is that most people are going to have compromised immune systems just simply because of the background radiation. It's just something that happens because of that, and it means that people are going to be more vulnerable to infection, and infection leads to complications, leads to surgical wound breakdown, and causes all kinds of problems. So yeah, something to bear in mind. And there is just bits of bloody skeletons everywhere in here, bloody hell. Anyway, yeah, so that's the kind of thing that you're looking for if you're going to be performing surgery in the Wasteland. I say surgery always carries risks as well. Even the best surgeons in the world can still have not so good outcomes because the body's unpredictable, biology's unpredictable. You never quite know how things are going to happen, and because the facilities aren't ideal in the Wasteland, the chance of complications is going to be higher, unfortunately. And there's only so much you can do to mitigate that. But we do have some interesting medications that are available to us in the games. Okay, so the next part we're going to talk about today is some of the kind of most important meds that you'll find in Fallout. There's quite a long list of chems, especially once we get to Fallout 4's generation, as well as a lot of kind of herbal things between Fallout New Vegas and Fallout 4, so we're going to get into them next week. But these three are your major players. The Radaway unfortunately ended up face down, but the stim pack is obviously the main healing item across all of the Fallout games, and we don't really know exactly how they work. It's obviously a sort of injection of some kind, and you can get the auto-inject stim packs as well as the super stim packs in Fallout New Vegas, and they generally just heal your hit points or your health points, and they can also be used on specific limbs to improve their condition in some games and some modes of the games. So they obviously speed up healing, and one would assume that they help control bleeding as well, because if you're losing hit points in this game, it's either because you've been shot, you've been stabbed, or you've been bitten or punched or something like that. So blood loss is potentially an issue. So I would assume that stim packs do have something in them that controls bleeding. And there is a drug, at least one drug in real life, that can be used to help control bleeding and to boost clot formation, which is tranexamic acid. That's a drug that's used for an awful lot of things as well, and even things like aloe vera. There's factors in aloe vera that definitely have properties that improve the outcomes of wound healing, and it is something that's been used for a long time for that, before modern medicine really became a thing. So we know that there are substances that can have some of these effects, but when it comes to stim packs, it's very much your healing potion or healing spell that you would find in a fantasy RPG in the Fallout universe. So it's one of these ones that can't really look for too much realism here. They just work. I know. But, science fiction does sometimes become science fact, so it's possible that in the future something a bit like the stim pack may be developed, and it might be something that exists. Because they seem to work quite quickly, they could be very useful for sort of military medics to use and emergency medics to use, so, paramedics, EMTs, and sort of emergency rooms, that kind of thing, and on battlefields and war zones and things, something like a stim pack would potentially be quite useful. But it is one that's the most kind of video gamey kind of panacea there, that you can't really expect to find too much realism in the presence of stim packs. So it's one of these ones that it's probably how they actually work is probably left deliberately vague for that reason, because it's very much a kind of video gamey thing, because in a game like this you need to have something to restore your health. But I do like that, sort of later on in Fallout New Vegas hardcore mode, they work overtime, and in Fallout 4 they kind of work overtime as well. That is a bit more realistic than just magically everything's fixed within an instant. Like in Skyrim, where you can literally pause combat and eat 20 cheese wheels to get all your health back. It's, so we need to kind of keep that in mind. But I think the more interesting ones is the radiation drugs. So you've got your Rad-X and your Radaway here. So Rad-X, it's in tablet form, it appears to be anyway. And it's something that's obviously a big feature in the Fallout games is radiation. It's in the name, it's in the whole story. And I'll put a wee link to my radiation video. So my Science Fallout series, the first thing that I talked about was radiation, the dangers, the effects, what radiation sickness is like. So I'll link that if you've not seen it, just to kind of get a picture of what we're worried about and what we'd be trying to prevent here, especially if you're going to go adventuring and go digging through radioactive ruins. You're going to want to take steps to prevent radiation sickness, so that's what we're going to talk about here. So Rad-X is the preventative one, so you would be taking it before you go into the warm and glow, and it improves your radiation resistance in the game. And then Radaway, kind of self-evident in the name, it purges radiation from your system, and it does appear to be like it's in a bag of fresh frozen plasma, and would assume from that it's supposed to be administered intravenously, so directly into the circulation. So we don't have these specific things in the real world, but I did do a bit of research into what is available, because we do have history of nuclear disasters, nuclear bombs. That there's been incidents that have happened in real life that have taught us a bit about, radiation sickness itself, and helped us find ways of mitigating it and of dealing with it and treating people for it. So it is something that is quite an important thing. Not just talking, obviously we had the nuclear bombs in Hiroshima and Nagasaki, but there was also several kind of nuclear power plant incidents, like in Chernobyl, like in Fukushima in Japan, that was caused by the tsunami and all the rest of it. So it's something that people need to be aware of. So the World Health Organization has produced a paper with guidelines, and it also includes a list of pharmaceuticals that should be stockpiled for dealing with radiological or nuclear emergencies. So there's quite a few things on the list to kind of help mitigate and to help treat people that have been exposed. So stable iodine is quite important, and generally potassium iodide is the one of choice there. And its function is to protect the thyroid gland. So iodine is only used for one purpose in the body, and that's to make thyroid hormones. So radioactive iodine getting into the body can cause damage, and it can trigger thyroid cancers and things like that. So potassium iodide basically blocks the radioactive iodine from getting into the thyroid gland, so it means that the body will then get rid of it, so it protects the thyroid. It's the same way that if you are taking x-rays, or even if you're having x-rays but it's not to do with your neck, then you'd be given a lead apron, but you might also be given a lead thyroid protector, so like a collar that's got a layer of lead, that's to protect your thyroid from the ionising radiation. So it's something that we know is very important. And then you've got chelating agents, which are basically agents that can bind certain molecules or certain substances and help the body kind of eliminate them. So two of the major ones that are mentioned is something called Prussian blue, which I have to admit until today I thought was just a paint pigment, but apparently it does have a medical use as well, and it binds radioactive cesium. And then you've got two different ones, which I'm not going to try and pronounce the full name, but there's calcium DTPA and zinc DTPA, which can purge transuranium radionuclides. So again, that's clearing out uranium, which is obviously an important thing. And there's also sodium bicarbonate, which is given IV, so potentially that could be an ingredient in Radaway, and it helps with uranium intoxication, so it can help flush uranium out of your system as well. And then you can use cytokines, which help mitigate bone marrow damage, aluminium antacids like aluminium phosphate and sodium alginate, which is kind of like your sort of Pepto-Bismol, that kind of a thing, actually can be quite helpful for protecting the guts as well, and they can bind some of these radioactive elements which means that basically your body eliminates them instead of them hanging around in your body and causing problems. And other important treatments for dealing with radiation sickness include antiemetics, so that's drugs that stop vomiting from happening. Ondansetron is the one that's I can never pronounce this one. Ondansetron is the one that's kind of mentioned in the literature from the World Health Organization, and antidiarrheals as well, because one of the main symptoms of radiation sickness is vomiting and diarrhea, which leads to dehydration and can become very serious. So having antidiarrheals like loperamide, which is, I think certainly in the UK most people would know that as Imodium. There might be different trade names for it in other parts of the world. And that can help to kind of reduce the fluid loss from the gut in the event of radiation sickness. And some people would suggest prophylactic antibiotics because radiation damages your immune system, it suppresses your immune system. So infections are a bigger risk to you, so antibiotics might be something to consider. So a lot of these things kind of fit in with what we would expect with, what could be included in Radaway. But obviously, and if you're playing Fallout 4 in survival mode, Radaway suppresses your immunity and makes you at risk of sickness as well, so keep that in mind. But radiation damages the rapidly dividing cells in the body first of all, so that's why we're worried about the bone marrow and the immune system, and that's why we're worried about the gastrointestinal tract, because they're the parts of the body that kind of suffer the most with acute radiation sickness. But we do have lots of treatments for kind of health and radiation, so this is your main three kind of healing items that you're going to want to collect whenever you can in Fallout 4, or in any of the Fallout games actually. You're going to want to collect as many of these as you can get your hands on, because they're going to be your mainstay of treatment. But there's a whole bunch of other chems and aid in the game that we can talk about, so I think that's going to be a separate video so that none of these run for too long. Yeah, I have collected quite a lot of stuff on this character, but you've got your Psycho, you've got your Buff Out, you've got Medex, you've got Jet, and then in this game you can combine all them together. So that is going to be a whole video on its own, I think, because that is quite a lot of things to cover today. And we do also have some herbal options as well that you can use, notably in this game, especially in survival mode. You can make certain herbal remedies, and in New Vegas it's quite a big part of the crafting system as well, which I think is really interesting because the Mojave Wasteland is full of all kinds of useful plants. So it's quite good to that's kind of made use of in the game, and you have that crafting system. So we'll get into that at a later date as well, because I think that's a really interesting aspect of the medicine side of the games. But for today, we've talked about how you might perform surgery if you're brave enough to do it, but make sure you at least have some idea of what you're doing before you operate on other people. And try and keep things as clean as you possibly can, which is obviously not easy given that everything is trashed. But it's something that's worth keeping in mind, I think. So hopefully you found all that interesting. Obviously, I always love to hear your thoughts in the comments. And if you've got any questions or anything like that, then let me know. Subscribe if you want to see more, and I'll see you all next time. Bye.